I've certainly been following, and I've actually, in a couple op-eds, talked about the case fatality rate versus the infection fatality rate. I've been monitoring what the estimate is, the prediction is from Oxford Center for Evidence-Based Medicine. For months now, they've been predicting the infection fatality rate is going to be somewhere between 0.1 and 0.4. I think now it's 0.1 and 0.35. You talked about in an article about these seroprevalence studies, 82 of them now are kind of pointing to a 0.2% infection fatality rate. Seasonal flu, and I've printed this out from the CDC website, a bad year is about 0.18. So just a little under that. Again, I'm not downplaying COVID. As Senator Paul talked about, people he knows, as those of you who've treated, it's a deadly disease, and particularly for over 70, 5% of the people with COVID die from it, okay, or with it. So I'm not downplaying this, but I think you have to look at those numbers and ask, what have we done, and what is the human toll of our actions on a disease that long-term it looks like it's certainly worse than the flu, but is it that much worse to cause that much economic devastation with that severe human toll? 130 million people starving, and of course we heard all the other follow-ons. But anyway, Dr. Bhattacharya, if you have your closing thoughts.
Sure. Thank you for this opportunity to testify, and thank you for that lead up. I mean, I think it is worse than the flu, but it has very different properties than the flu. Older people have a much higher rate of death from this than younger people, which is a different. I mean, the flu also has that pattern, but not quite so pronounced. That means that we should have a different. But the most striking difference in how we dealt with the flu versus how we deal with this is not actually in the treatments and all that. I mean, there's obviously vaccines and other things that's different. But the most striking thing is that in the case of the flu, we do not induce panic, and in this case, we have. Panic has been part of the policy, has been part of the lockdown. I think has caused enormous harm. It's a violation of all that I've ever learned about standard public health practice, which is generally to reassure the public, provide good information, and seek to develop good treatments and preventative activities. Instead, we've just panicked the public.
This is not the flu. I've been a doctor for a long time. I will tell you, from the earliest onset in this country in New York, in one major healthcare system that I helped work with, they went from 95 ICU beds in a span of 2.5 weeks to 350 ICU beds. Gastroenterologists were taking care of dying patients on ventilators. We do not do that with the flu. I have done nothing but take care of COVID patients since the beginning. We have ICUs dedicated to COVID patients on ventilators. That is not what happens with the flu.